there is this patient that I have been seeing for about 4.5 years now. Initially diagnosed with claudication, very keen to have an endovascular procedure at the time because best medical therapy had failed. Then the patient had femoral popliteal disease, so a blockage of the main artery in the thigh with some disease of the artery behind the knee called the popliteal artery. I was convinced to do an endovascular procedure. Then, unfortunately, the patient has come back for about 7 or 8 re-interventions in the meantime. Not very old, I would say, let's say early 70s, let's put it there. Several re-interventions. Her stents have blocked 2 or 3 times now, opened them up with atherectomy, eventually ending up with common femoral artery and arterectomy, and following that, another intervention and subsequently needing a bypass. So a couple of lessons from me there. I think, first of all, best medical therapy and exercise is extremely important in people who claudicate. And I most definitely do not offer interventions now to people who claudicate unless they've tried some decent exercise for a few months. Mm-hmm. And the second thing, we discussed this a couple of times during our chat before, bypasses and endovascular procedures. Well, sometimes bypasses are far more durable than redoing an endovascular procedure 5 or 6 or 10 times. And in fact, a more invasive procedure at baseline for certain patients might be the right choice. So I'm far more open-minded now about doing bypasses for the right patient.
And that's what your research is about, is trying to figure out who is the right patient.
Absolutely, yeah.